Taylor Begley in studio with Dr. Paul Fadale from University Orthopedics, and it is that time of the season where guys are banged up, dealing with the length and the intensity of a football season. Just normal wear and tear for a lot of these guys, just grinding through the physicality of the game, would you say?
It's horrible, and we added one more game, so yes, the injuries just keep going up every year.
Yeah, and that one more game, does that really make a big difference? A lot of people who maybe don't know the game or play the game might say, it's just one more game. How big of a deal can one more game be?
You know, we don't have numbers on it, but the amount of pounding these people go through, it's just the average fan may not truly appreciate how banged up they are. And so that one more game, it's only one more game, I think it takes a lot of toll out of these players. And for the more seasoned athletes, it's going to be even worse to possibly shorten their careers. So it is a big deal. But this is about money, and they get paid.
Of course, of course. But for some of those players that say maybe were banged up in training camp, like a Cole Strange, who dealt with a knee injury in training camp, dealt with something all year long, got out there, he gets hurt, you see the cart come out on one play. And is that something that might be a result, while we don't have exact information on the injury, a result of potentially just a buildup of wear and tear that led to a blow?
It's a great question, and I think scientists are going to look at this, but we have to get years of data before we say, wow, when we went up to 17 games, that one extra game, now we don't know what the injury rate's going to, but it may go up, and they're going to turn back and say that's exactly why it went up. Problem is that information takes time to get out, because to get a real scientific approach, it takes years.
Let's talk about a guy, Cole Strange, goes out with a knee injury. The cart immediately comes out. They immediately rule him out. We don't have the information on what the injury is, or even any speculation as to what the injury is. But when you see a guy that's ruled out right away, the cart comes out right away, does that give you any information as to how serious an injury might be?
So I don't know if you probably saw how he got hurt, and I'm not really sure how he got hurt. So it looks like he was just being pushed back. I don't know if he stepped on the quarterback's foot or something. All of a sudden, he was on the ground. So now you have to ask, is this an old injury, a recurrent injury that they knew he was just Band-Aid together, get him out there, and they said, yep, now we popped it. Or this was a new horrible injury like an ACL. It's unknown at this point. And it's kind of interesting, because usually if it's an ACL type injury, it's already out there. It's in the news and everybody knows about it. Right.
And another big injury that we saw earlier in the month was Ramondre Stevenson, a big key to this Patriots offense. And the way it was done, we'll talk about that, because a little bit of a controversy within the NFL as of late. But Ramondre Stevenson reportedly has a high ankle sprain, expected to miss a few weeks. He went down in that game against the Chargers, which was on December 3rd. So it's been a few weeks. At this point, they haven't put him on injured reserve, which means he would miss the rest of the season. 2 more games left. Do we see a guy like that come back?
Ooh, young guy like that, I don't know if that's a good idea. These ankle sprains can take upwards of 6 weeks or more before they healed, and I don't think he had surgery on that. So one of the options are put a couple of tags across the ankle, secure it, and try to get him back sooner. They didn't do that. So I don't know if they're going to want to push back such a valuable member for maybe one game. They're not going to get to the playoffs. That's already been figured out. So what would be the advantage for someone who was the offense? So my humble opinion would be you might want to rest someone like that, start again fresh next year and let them go.
How do you think that answer might be different if, say, the Patriots were playing for the AFC East right now, for the playoffs, and had all these things ahead of them? Do you think you would see him come back maybe more so than if they're in the situation that they are in now?
Yes. So if we're going for playoffs, it's all different. So I don't care what the sport is. Once we get into the playoff season, we treat our athletes very different. So Novocaine, Marcaine comes out, numbing medicine comes out. Maybe do that surgery to try to squeak in one more week of recovery. Everything would be different. But the Patriots are having a very tough year, so there would be no benefit that I could see of risking a superstar in your system for one game, which or 2 games, which could be meaningless.
And especially the toll that a running back takes on every single hit, every single year. Exactly. And if I'm not mistaken, Patrick Mahomes in the Super Bowl run this past year was dealing with a similar high ankle sprain injury, I want to say, and he was able to play through it, but probably because of some of those methods that you...
There's no doubt. So again, it is amazing how different the behind the scenes action is, and with some of these athletes who really can't feel anything, they're just numb, and they will have these rib fractures and really broken bones, and they play. It's terrifying, but when you have a championship to go for, you may never get there again. You're going to go for it.
Yep. And we mentioned, or I alluded to earlier in my question, was that the hip drop tackle was how Ramondre Stevenson was taken down when he got hurt. That's gained some traction amongst people in the NFL. The NFL always trying to make things safer for players, always wanting the star players out there. One of those plays that's come under fire is that hip drop tackle. So from a doctor standpoint, and also a football fan who knows what he's talking about when it comes to football, when you see that, is that something that is dangerous and potentially should be a topic of conversation to get rid of? Or do you think it's one of those plays that it's just part of the game?
So the NFL is definitely looking at it. The statistics, if you can believe them, or if you tackle like that 25 times the rate of injury, it's pretty high.
Wow. Okay.
So if you go back and you say hitting in the head, bad idea, so we got rid of that, and concussions dropped a little bit. Tom Brady got hit in his knee. You hitting the knee too low, we got rid of that, saved some ACLs along the line. But now we only have the middle of the body. Now what are we going to tackle? So they asked the Players Association, you want to get rid of these tackles? They're like, nah, we don't think that's a good idea. Yeah, we're running out of ways to stop the offense. And what's even more interesting, what is even the hip drop tackle? Because when you pick a man up and throw him on his head, okay, we could understand that's not really good. But if you look at the way Stevenson got tackled, he didn't get tackled like that. They just sort of brought him down. His ankle gets caught under him, rotates out like they all do, and there goes a high ankle sprain. So they're looking at it for sure, but I think some of the players are saying, how are we going to stop them then? Where do we tackle? Can't go high, can't go low, and now we can't go in the middle. I think they're going to get rid of the athletes who drop someone on their head. But that's not
the
all.
head is precious.
But that's not all it is. So the hip drop tackle can be a lot of different things to a lot of athletes, and they're going at super speed. So again, it's very hard to say, well, if you start dropping on a player, then you got to let him go. I don't see it happening, but NFL for sure is looking at this.
Yeah, and you've heard both sides of the coin. There have been players that have come out that said, you know, the defenses are getting targeted too much. Where what can they do? You know, it's all to benefit offensive players. At what point do some of these rule changes and reassessments really change the game in a negative way?
Well, that's part of it. The NFL has done a pretty good job, actually, in trying to mitigate out the downside of some of the rule changes. But we don't want to see concussions. We don't want to see every player's knees cut out from under them. But if the defense can't tackle, or that's left into the eyes of the referee, was it a clean tackle or not, I don't think that's going to be good for the NFL. So they're going to look at this for sure. I think just when they pick up a player and dump him on his head, I think they're going to get rid of that. But I don't see if you're going down on an athlete around the waist and dragging him down. Boy, I think that's going to be a real hard sell to the NFL.
All right, great insight as always from Dr. Fadale of University Orthopedics. Thank you so much for joining us.